No matter what side of the political spectrum you may be on, left, right, center, if you're a resident of British Columbia, I think you would likely agree that we are facing a healthcare crisis. We have a shortage of healthcare professionals. All you have to do is drive by any walk-in clinic. You'll see the lines are super long, waiting for surgery, waiting for analysis, assessments. But BC's new healthcare laws are not going to improve that situation, contrary to what the government and the media may have been telling you. So in this video, I'm going to unpack what Bill 36 is all about, and I will ask you humbly, reserve opinion till the end, and tell me after you've watched whether this is going to help the situation or worsen it. British Columbia will lose more doctors and nurses, as well as physiotherapists, massage therapists, acupuncturists, naturopaths, chiropractors, dentists, and other healthcare practitioners as a result of the new Health Professions and Occupations Act of BC, in my opinion. And like I said, watch till the end, judge for yourself. This act was tabled on October 19th, 2022, by Health Minister Adrian Dix as Bill 36, and was then pushed through with little opportunity for debate or discussion and became law in BC on November 24th, 2022. When have you ever known government to move quickly, folks, and it was a success or something good came out of it? Debate? We've always encouraged debate. If this bill is as good as they say it was, what could it would not withstand scrutiny? The new law contains new provisions that can only be described as draconian. I know, sounds hyperbolic. Once again, watch till the end, judge for yourself. It gives the health minister power to appoint college boards, who then have the power, authority, and number one, must impose vaccination requirements on all health practitioners under their authority for any illness the government deems necessary requiring vaccination. Number two, must impose proof of up-to-date vaccination status as a condition of licensing. Number three, must dismiss without notice or a hearing any application for licensing or renewal of license that does not contain proof of vaccination. Number four, if any health worker dissents, and health workers can be doctors, nurses, any one of the other professions I've listed, they dissent, like I said, speaks out against the college policies or fails to comply, they may discipline. So the college may discipline with loss of license. Number five, if a healthcare worker is deemed to have made a false or misleading statement as determined by the government, so the government gets to decide what's misleading or false, they may, without notice to the person affected, apply for court orders too. So the boards can apply for court orders to enter into the premises to search, seize, or copy property, Section 506 of the Act. 2. Lock up premises and prevent an owner from entering, Section 511. 3. Fine healthcare workers up to $200,000 for non-compliance, Section 518 B and C. Number 4. Order jail time up to 2 years, Section 518 A, B, and C. By this new law, the BC government encroaches upon the professional autonomy of healthcare workers and their governing bodies. It also removes hitherto protected rights of bodily autonomy for the workers and vicariously for the citizens of the province. It also threatens the livelihood if they, for any number of valid reasons, believe they should not or cannot comply with government dictates and mandates. All this destroys a proper democratic functioning society. Further, since your healthcare workers can be fined or imprisoned for providing information or advice that the government deems misleading, the government is now, in effect, your doctor through coercion. Only its opinion is allowed and patients will have no choice. How does Dr. Dick sound to you? Finally, This will harm the public, again, doesn't matter what side of the political spectrum you're on, by creating a further service shortage in the BC healthcare system, which, as we would all agree, is already struggling due in part to the firing or retirement of health workers under the COVID vaccine mandates we've lived through for the last couple of years. These harsh new measures will only worsen an already terrible situation. And again, folks, I would challenge you. It doesn't matter whether you're on the left or the right side of a political spectrum. Cancer, any kind of disease, doesn't care. You are looking for the best in healthcare no matter which side you're on. So, what can you do? Well, if you live in BC, contact your MLA to object. Even if you don't live in BC, I would encourage those of you who live outside of the province, send messages to MLAs that are in BC and tell them how terrible it is. If you're in BC, vote for a government that will respect democratic freedoms and the professional autonomy and personal rights of healthcare workers. Support groups that are fighting to protect and maintain democratic freedom. Again, you can do this as a resident of BC, and if you're outside of BC, support those groups as well. Number 4, support your healthcare provider who is challenging the system. They need to know, folks, that you care. In addition to the section numbers that I already mentioned above, also see sections 49, 1, B and V, section 213, 3 and F, section 70, 2G, and 502, 503, 514, 2B. So, thank you for watching. I do appreciate it. This is a very important issue. It's a very important topic. It doesn't matter, like I said, what side of the political spectrum you're on, what side you were on the debate with respect to vaccination or anything else. There will be another health crisis that will be coming. There will be things that are happening, folks. Your healthcare professionals should have the autonomy, the freedom to speak out so that they can provide you in the best form of healthcare, not healthcare that's mandated from somewhere above or a one-size-fits-all solution, because it should be personalized healthcare. And as taxpayers, as citizens of this province, we deserve that minimum level. Anyway, thanks for watching. I do appreciate it. Please post any comments you have in the comment section. You can follow me on my Rumble on my Locals account. Also, if you're on my Rumble, subscribe to my channel there, because occasionally, just like Section 36 of the Act, YouTube decides that, hey, time to get off. I don't like what you're saying. So there you go. Anyway, thanks for watching. See you next time.